So another issue that we deal with in the thoracic spine, which is essentially where your rib cages are at, is we can have subluxations and misalignments in the vertebrae themselves, okay? But because the ribs attach to every one of our thoracic spine vertebrae, we can actually have rib issues. And a good indication that there's a rib issue going on is if we can't get a deep breath in and it's painful. And a lot of times when that's going on, there's going to be pain that wraps. So a lot of times it'll start here at the base of the spine and it'll wrap around where that rib line is actually going and transitioning to. And so if somebody's coming in and they're talking about can't get a deep breath in and they have this pain that kind of radiates around, that lets us know that we have some ribs that need to be checked. And there's a lot of different ways to check to see if we have those rib issues. One of the easiest ways for us would be just to apply some pressure into them. Similar to the spine, they should give away from us. But if they don't and it's fixated, that lets me know the specific areas as to where I want to adjust that. Okay. Now, if I'm going to be adjusting a rib issue, I'm going to be contacting on the front side of her hip here and applying some pressure up. And I'll have her take a nice deep breath in. And as she's taking that nice deep breath in, we're just going to apply some pressure up. And then with my right hand here, I'm just going to be applying some pressure down. And generally, those ribs tend to just fall right back in place. And it's amazing. Once they fall back in place and the patient comes up off the table, almost immediately they can get a deep breath in without any pain, and that wrapping pain will go away. And a lot of times when we're having those rib issues, a lot of it's posture related. If our shoulders are rounding, okay, our head's pulling towards the front, it's putting a lot of pressure back where it shouldn't be, and it can cause those ribs to flare and cause those conditions and those pains that the individual will be dealing with.